Hello folks, today we're actually going to talk about the embryology of the respiratory systems, and I've already actually pre-drawn this diagram so that way we can actually move a lot more faster. So what I did was that I drew pictures of this, of the embryo and more in a sagittal view. So if you look at it, okay, so before we even start, I'm just going to quickly label this part just to make sure that you guys know what we're talking about. So like this one is the sagittal view. So this one we're going to say this is your cranial part, this is a cranial part, and this is going to be your caudal part, and this is going to be the development of your head. All right, now and then you see this, the protrusion that's coming out, that's going to become your future mouth, okay? That's going to be your future mouth, and we can say modium, or you can just simply say mouth, all right? Now, and then this layers is going to be your ectoderms, and there's going to be blood vessels and all. Blood vessels will be going there, and this layer right here, this one, orange, we're gonna, this one is going to be in your, this is going to be your endoderm, okay? So endoderm linings. So I'm just going to write down this as a, your endoderm is going to be this one, all right? And then right here, so usually what happens is like there's a divisions of from like down here to like up to here. This whole portion is from like, let's just make imaginary line here, from here to this way. We're gonna call this as a foregut, okay? This is gonna be a foregut, all right? And then from here to here, we're gonna say this is a, let's make an imaginary line from here, okay? And then from here we'll make this has a midgut right here, and then down there, that's going to be my hind gut. All right, hind gut. So if I make an imaginary line there, that's going to be my hind gut here, right? So now, here, so this is going to be like, okay, your pharynx, and then later that's going to become your esophagus, and then this is going to be, you see this, that's going to be your stomach right here. So that's going to be my stomach. All right, and then also like there's, if you see down here, there's a small protrusion coming out. That's called liver bud. Okay, we'll just name that as a liver bud there. All right, you can also see like this is going to become your, later that's going to be duodenum. There's going to be, you're going to see like dorsal pancreas as well. All right, and then right here, this is called your, you can say like a Valentin ducts. All right, I'll just write down the VD, and then this is going to be your later your allantois. Okay. All right, now the most important thing is here right here. What did I do here? This one's right here, we have actually discussed about this in embryology of the heart during the cranial folding or lateral folding or caudal folding. We have talked about that. Really what happens is like around like 15 or 16 days, like some of the cells from your splanking mesoderms, they actually migrate. And then they're going to make this area called like a cardiogenic areas, and then after that, that's how the heart tubes forms, and which is level as this on the red right here. This red is level as this as my heart right here. All right, and then like also that at the same time, what will also happen is that some of the because if I want to quickly talk about this, actually let me just quickly talk about this. Remember, like if I make this cells, let's make this as one cell right here. Okay, let's quickly talk about, and this is, what is this first? So this is going to be my ectoderms, right? And then here what's going to happen here is, okay, there's going to be a notochord here, and then there's a cell right here. This part of area, okay, there's a cell, some of the cells migrates from the ectoderms, and then start making the layers of cells, right? These cells, we call this, the cell down here, they will start migrating like this, okay? And it will become, so and both the side this way, too, and then it'll go like that, right? So basically, same thing here too. And then, just quickly talk about this. So if I make, and then this another layer of cells right here, let me just draw it in a different color here, and this is going to be my endoderm right here, right? And this is going to be mesoderms right here, right? So these mesoderms has three different parts, right? You have the paraxial mesoderms, okay, and then this is intermediate mesoderms and lateral mesoderms, okay? And the lateral mesoderms further divides into two parts, and this layer that is going to the endoderm, we call them splenic pleuric, and this one is going upward, we call them somatic pleuric, okay, which is called them somatic pleuric mesoderms, and this is a splenic mesoderm. And in between this space, this is called interembryonic coelom, okay, or we call it interembryonic coelom or cavity forms. And later those interembryonic the coeloms, when they come come and fuse together, what happens is that they'll later give a drive to this this pleural here, and this one is called your pericardial cavity. Okay, this is going to be a pericardial cavity. All right, so this is what I was referring to this. Okay, and then this is this later says, I just drew that too. This is actually going to be some of the connective tissues arises and go on top of your cardiogenic area. For example, if you remember from the shape of the heart, whenever we did this view of like this horseshoe shape of the structure like this. If you remember this horseshoe shape of structure like this, okay, what's going to happen is that there's going to be primitive streak, primitive groove, and all that kind of stuff. Remember, guys, that kind of stuff. And then really what happens is that for some of the cells, like I said, migrate from here and go and make a cardiogenic area, and this will be cardiogenic area. And then later, what's going to happen is that there will be also formations of some of the cells on top of the cardiogenic area. And this area, we call them a septum transversum, okay? And that septum transversum is very important for actually giving rise to your diaphragm, right? And we'll talk about that. And that's why I'm referring this as my septum transversum, all right? Okay, now, this is what I was referring to. Now, so I was just labeling all these different structures, and then as we go, we'll talk more about this one too, right? Now this is all the liver right here, right? We'll talk about this now. And then, so what's going to happen is the respiratory development takes place around like around the 4th week or so, okay? So really what happens is that if you come back here, guys, in the endoderms, really what happens is that the respiratory, the respiratory system develops developments of your lungs, your alveoli, your trachea, and the epithelial linings of that. It is derived by, or it is given rise by your endoderms. Okay, your cartilage or muscles or the connective tissue, and those would be coming from your visceral mesoderms, okay? Those are visceral mesoderms. We'll talk about that too, okay? But first what happens is that around the 4th week of development process, so what happens is that there will be median outgrowth. Like median outgrowth, you get to see in area right here. We'll show it with different colors actually. Let me use this as my green color, okay? There is some median outgrowth, like some of the cells from the endoderms, what happens is that you get to see this, okay? Some of the cells start appearing here. And these cells, what do we call that? We call them as, okay, median outgrowth you get to see. And this is called, you will see this here, we call them as a laryngeo diverticulum groove. Okay, it's a groove. So laryngeo diverticulum groove, you get to see that, okay? And guys, I'm really bad at spellings, but you gotta you gotta look it up if I'm making mistakes with my spellings, all right? It's a laryngeo diverticulum groove. That's what you get to see on here, right? And remember, guys, the appearance of this this laryngeotracheal diverticulum, or even what's going to happen is that this laryngeotracheal, what happens is that this will start evaginating or protruding or start expanding, and what happens is that it will form a structure, a pouch-like structure, which is called laryngeotracheal diverticulum. Okay, I'll make this as laryngeotracheal groove. Okay, now this is going to be this structure, which, okay, it was a group that will form, and what happens is they will start evagination, start protruding out, and then it will become laryngeodiverticulum, laryngeotracheal. Okay, I didn't even write down tracheal here. Laryngeotracheal diverticulum. That's what you say. So this will be laryngeotracheal groove. Let's just say laryngeotracheal groove here. Okay, and this would be a laryngeotracheal diverticulum. Okay, it's a pouch-like structure. It's a median outgrowth of this. So if I do a cross sections of this, and if I put an axial view, what do I do? So this is going to be my pharynx. Okay, and then if I make the structures of the foregut, because that is giving rise to my foregut, right? So if I make a structure right here, okay, guys. So like let's make a tube like this structure right here. I'm going to make a tube-like structure right here. Okay, I'll make a one tube right here, and then. Okay, we'll just make a tube like this structures, okay? And then you're going to see what's going to happen here is that you're going to see the lining coming out, or we'll make it with the green. That is going to be what? That's going to be you're going to see groups coming out, and this is going to be my groove, okay? And then obviously this is going to be my what? My tube right here. And this is going to be my you get to see, I'll just make this as coming out from here, median outgrowth. You're going to see something like this. Okay? And then, so this is going to be my diverticulum, okay? So this is going to be my, now, and then there's another name that is going, so this is also my tube actually. I'll just make it a smaller tube. Alright, hold on, the color is correct, so let's just make, oh, hold on, let's just make it quickly. So what we do is, okay, we'll make a much smaller one this time. So this makes it easier for us. Alright, so basically the correlates, and then you're going to see. Alright, so this is going to be like this. So this is my foregut right here, right? And then what happens is that there's a small diverticulum you get to see, okay, and we also call them as not only they different name is given, okay. So sometimes they call it respiratory diverticulum, they also call lung bud, all right. Just and then also there's a you can say laryngotracheal diverticulum also. That's what is happening, and it's coming from the foregut, okay, and the endodermal lining of that. Now, this respiratory diverticulum or laryngotracheal diverticulums, okay, these are very, very important, okay, and they for appearance of this is very important. Importance of this thing, okay. What is that thing called? So, you know, whenever there is an increased level of like this acid, and what is this acid called? It's a retinoic acid. There's a role of retinoic acid. Retinoic acid plays a very, very important role here. The increase of level of retinoic acid plays an important role of the appearance of the respiratory diverticulum. And other thing is that there is also this transcription factor, okay. Now I'm going to write this as a transcription factor, also play a very, very important role in transcription factor, okay, TRP transcription factor. And what is that factor is? It's a TBX4, okay. And this, and then retinoic acid, like, you know, this is actually what is the most important thing is that retinoic acid is upregulated by these transcription factors, and is really important. So a good amount of having a retinoic acid is supports this appearance of respiratory diverticulum, because remember, if the respiratory diverticulum does not form, then we can get a pathological. We can get pulmonary agenesis or unilateral agenesis, which basically means this respiratory diverticulum we're not able to form. If it's not able to form, then it's not going to be able to form your lungs, right? So that's the most important thing here. Now, this is very important. Now we also have to know that where is this retinoic acid is coming from. The retinoic acid is obviously produced by your adjacent mesoderms, okay? So this is obviously required by your edges mesoderms. You can just simply say mesoderms for our case right now, all right. And this one is obviously by your endoderm, all right. Now, secretes by endoderms. Now what's going to happen is that we have to understand other couple of concepts here, and that other couple of concept here is that. So here you see that in the ventral wall of your foregut, you have this respiratory diverticulum coming out. So as we go from here, we have to draw the same color, and then we'll keep it this way. Where's the green color right here? So now, we'll make this as a tube right here. If we make a tube right here, okay. So this is my another tube right here. I'm making this tube, and what is happening here is that now, all right. So as this lung, this respiratory, as it gets elongated, and it's elongated like more caudally, what happens is that, okay, what happens is it's getting bigger. Then we'll make it with the green color right here. What's going to happen is that this is going to go, it's going to form like this, right? And then what is going to happen is that as it grows, it's going to start divided into a couple of things, all right, like this. Grows like that, and as it grows, also what happens is that it makes like, and it starts forming like ridges too, like this, okay. So you see that I made a ridges right here, okay. So now as this elongates, what happened is that now it forms this, like, it divides into, there's a two bifurcation you get to see, and this bifurcation we call them as what? We call them as, okay, you can say BRONC, bronchial bud, or they also call lung. The two bronchial buds you get to see. And obviously, what is this part? This part is obviously going to be your trachea, right? Now, and then right here, you see this one? These are folds. You get to see this right here. These folds is what is it doing? These folds or these ridges are appearing here, okay? And then this ridges first appear, and then the folds forms, right? And these folds are longitudinal. We call them a longitudinal esophageal fold. What do we call them? We call them a you can say esophagus or esophageal folds. That's what you're gonna get is esophageal fold, okay? Now, these are esophageal fold, and these are longitudinal esophageal fold that you get to see, right? Because remember, this later what happens is that as this grows, we're gonna make another drawing here. So keep going right here. So I'm gonna go do this, okay? And then making this way, right? So if I make the lungs right here, this esophageal folds right here, what happens is that they will come and fuse together, okay? What happens, this will keep growing caudally, okay, downwards, and what happens, these ridges here down here, okay, this will come and fuse together. So when they fuse together, what happens, it forms a septum. We call them a tracheoesophageal septums. And then that tracheoesophageal septum is the partition between your esophagus and your trachea. That's what it is, okay? So now, if that's the case, then when they fuse together right here, so let's say these folds are now fused together. When they fuse together, okay, then it's going to become something like this. You'll have this too, and then you'll have like that. So you have trachea, and then you have two bronchial buds. You see? Now, if I want to make it very, very quick, want to know how does the structure work, so let's just make this as and let's just make this a little differently. So if I make it, okay, if I make this, and then let's just make this, okay, this is my esophagus right here, and this is my trachea right here, okay? So in this case, really what happens is that, like now here, see these are called ridges, okay? And these are, okay guys, and then also here, like what happened, there are different type of signaling proteins playing a very, very important role here, okay? They're like, you know, some of those like SHA gene or like Sonny Hedgehog or WNT genes also play a very, very important role into it here, okay? But the most important thing is that right here, like see these are ridges that form right here, right? So what happens when these ridges come together and this esophageal folds, when they fuse together, when these guys fuse together, it will separate out. So it will become, so if I make this in the same color, what happens is that it will fuse together, okay, and becomes one as your esophagus, and the other one becomes your trachea, like that. So you get to see like this, okay? So this is very important. And these are very, very highly regulated by obviously signaling proteins. That's very, very important role for these guys to actually partition and becoming different things. And because it's really important to have a partitions of your trachea and esophagus, because if somehow the trachea and esophagus are not able to divide, then there's a clinical pathology related to that. We call them as like if there's a defects in tracheoesophageal septum, then there's a condition called tracheoesophageal fistula will appear, and there are different types of tracheoesophageal fistulas are there, and we'll talk about that as well too. But these are called your lung buds, all right? They're called lung buds. All right, these are called bronchial buds, if you want to be very, very clear. And this is like now you have your esophagus or you can say foregut or your this trachea are divided. Okay, I mean they're separated. And remember, even though like your esophagus and your tracheas are divided, but still what happens is that, look, if you look at the diverticulum, okay, we'll make this we'll make it a little more bigger here, try to understand here. So what happens is esophagus is like this, there was still some connections with this thing, okay, and there is a probably they still make some connections even though this brought off, but what happens, there is still be connections with the larynx, and this is called laryngeal orifices, okay? That's what they call it. But the most important thing here is that we talked about how these tracheoesophageal fistulas are formed, right? Now let's just quickly talk about some of the clinical correlation related to this. So as I said, that if somehow, let's say you have your respiratory diverticulum does not form, then you can get, if let's say there's no formations of respiratory diverticulum, okay, then you can get what? You can get a pulmonary what? Pulmonary agenesis, right? That's what you get. All right, and one of the things is these are very, very rare conditions. These are very, very rare conditions, right? But what can be happening is something called unilateral pulmonary agenesis, which basically means is that, okay, maybe the one side of the lung, maybe it did not form, the lung bud did not form, and wasn't able to develop into trachea, or wasn't able to form a lung, but it was able to form what? The other side of the lung. So and this could be compatible with your life, okay? And now then we also have to talk about the other very important clinical correlation related with this one is, we call them a tracheoesophageal fistula, right? So for this one we'll talk about, so pulmonary agenesis, we'll talk about this one. Other one is this condition which is called tracheoesophageal fistula, okay? And there are different types of tracheoesophageal fistula. Okay, let's just quickly talk about this different types. Okay, one of the most common that I'm going to do is, okay, we'll just do, okay, what is this? We're going to make this as a trachea right here. Okay, so this is going to be, I'm just making this one right here. Okay, this is a trachea right here. Okay, and then with a trachea, I'm making this two-sided in a different way. Okay, and we'll just do this way. And the two long bouts you see making, right? So really what happens is that, so sometimes what happens is that there will be so I'm drawing, this is my trachea, right? I do this part, but with the esophagus, like this sort of what I'm gonna have is, there was structure looks something like this, the one structure looks something like this right here. Okay, so this is gonna be what? So this is, we call them as a, so really whatever, this is esophagus, this is a proximal esophagus, and this is the distal end of the esophagus, right? The proximal and distal end of the esophagus, right? And then this is what is called tracheoesophageal fistula right here, with the esophageal atresia is also seen, and this is one of the most common thing you get to see, and this is more common in male. This is what you get to see, okay? And then sometimes you also get to see like this, okay? This is most common, and other conditions sometimes you also get to see is, you have this thing called, look right here, okay? Obviously like this, and then you have okay, this is, what is this? Bronchi right here, and then what you don't have is that you have there is nothing there, like look, like this one here, and one is right here. Okay, there's no communications, okay? So this is also where the esophagus, there's a two separate, the two separate esophagus is there. There's also, you get to see that on the, and this is like, this condition is called esophageal atresia now. You see that the two esophagus are not connected with all of them, but this is a proximal one, and this is a distal end, okay? This also you get to see in very common times. Sometimes there's also another thing, like, where you have this thing right here, okay? And then you have this structure right here, right? The bronchial buds and all that stuff, right? And then what happens is that the proximal ends of your esophagus are connected with this. Okay? But then your distal esophagus is not connected like that. So this is a proximal right here, okay, and there's a distal end of the esophagus, right? These are also another. So let's make this as A right here, this make a B right here, and then this is C right here, okay? This is also good to see. And sometimes, like, I'm just labeling these things, and just for you guys to know, sometimes you can also see something like, there's a communications problems with this, right? Basically, like, what happens is that, like this esophagus right here, you can have something like, there's a communication problems, or there's a communication, the narrowing of these things also happening there, okay? So This is also can give tracheoesophageal fistula, okay? And these are like some of them. These are the 4 different types of like tracheoesophageal fistula you get to see. The most common being this one. This is the most common right here, okay? And most of the times, like some of the conditions with the tracheoesophageal fistula, some of the conditions are very, very common with the tracheoesophageal fistula. Okay, I'm gonna write those down too. With the tracheoesophageal fistula, okay, what are some of the clinical correlations or clinical things that you get to see very, very common? Now let me just write down some of them things, and I'm gonna write it down. One of the things is like, okay, they remember as this, the mnemonic, okay, they call this is a VACTER, vector, okay? And the one other thing is, okay, what does V stand for? It's like, this is vertebral anomalies, all right? Now, and then 2 is, what is this 2 is? You are talking about your anal atresia, you're talking about, all right? And the C is stand for what? You are talking about cardiac malformations or cardiac defects, you can say. All right, and then T is obviously for your tracheoesophageal fistula they're talking about, and 5 is what? Your esophageal atresia, and then your 6 they're talking about renal, some renal problems too, okay? And also one thing that I do want to mention is that most of the times what you do get to see something called very, very common you get to see is this one. I'm going to write down in a very, very big color, and what is that? I'm going to use a different color for this one. Let me just write down in a red actually, and that is called polyhydramnios. Polyhydramnios, I think. So what is the polyhydramnionic fluid is, what it does is that, what happens whenever you swallow the amniotic fluid, it does not go to the stomach and your intestine, okay? So they also get to see that with the tracheoesophageal fistula, okay? With obviously with some kind of respiratory distress, you will have dyspnea problems as well. You do get to see that with this tracheoesophageal fistula, and we did talk about the pulmonary agenesis as well. Now this is something that I had to mention. So quickly, I do want to talk about is that, so we have to talk about like all the tracheas and your trachea and then the bronchial buds here. So now with this, I'm gonna keep going, and I'm gonna quickly erase this part, okay? Or I'll I'll just erase this part, and maybe we'll come back and erase this. So from there, what happens is that now I'm just gonna quickly separate I'm gonna separate this trachea, okay? And then I'm gonna put it here. I'm not gonna draw my this pictures anymore, which is a foregut, okay? So what happens is that now with my trachea right here, so remember all the epithelial lining of your trachea, okay, or your larynx, okay, if not your or your bronchi, or even your alveoli, they all are formed by your endoderms. But remember, the trachea has what? They're cartilage. They're C-set cartilage or so, right? All the muscles. They will all be derived by your visceral mesoderms. Or if you want to be very, very clear, remember we talked about the mesoderms. They're actually going to come from your splanchnic mesoderms. So that's what I wanted to mention that to you too, okay? So if you just make a trachea right here, right? If I make a trachea right here, making this gram goes like this. If I make this trachea right here, okay, all this, the lining of the cell that is actually going to form by your epithelial lining, which comes by endoderms. And this trachea, remember, they divide into two the bronchial buds, right? You're going to have okay, what's going to happen is it's going to go and becomes your what? Two parts. And this is called, okay, the two long buds, that's what it forms, right? It becomes your primary bronchi. What is it called? It's called primary bronchi. Okay? This is what it is. Then after that, what's going to happen is that, okay, we'll just make it, I will go this way. Now we make this, it divides, and then it will go from not only from the primary bronchi, we'll make a different structure right here. So we drew this, right? And then, okay, so what happens is that, okay, we'll just make this, so usually like your right, if I make this a right side will be little shorter and wider, and then your left will be a little longer. So this right bronchi, as it's growing, as getting bigger or expanding, what happens is that these guys will give rise to different things. What is this going to give rise? It gives rise into, from the primary bronchi, it will give rise into something called secondary bronchi, okay, or they also call lobar bronchi. And this primary bronchi, it gives about, okay, let's just quickly make this, it gives about 3 secondary bronchi from the right side of the heart. That's from the right. So it gives you 3. So let's just make this as, so it'll give you 3, 1 right here, 2 here, okay, and we'll make a 3 right here. Okay, it'll give you 3 secondary bronchi. We'll say 3 secondary bronchi. All right, or they call it lobar bronchi. And then your left side gives you 2 secondary bronchi. So we'll make this as a 2 secondary bronchi. We'll make this way, and then we'll make this way. Okay, the 2 secondary bronchi. All right, now after that, what's going to happen is that, okay, I'm going to erase this, guys. All right. So what's going to happen here is that this guys, all right, this guy, what these guys will do is, not only they'll give secondary bronchi, but also it will give, okay, I'll make a different color right here, right? So it's going to go, and then now this secondary bronchi, okay, we'll just have, okay, I'm just going to quickly draw this with the same color right here, okay, and then this is going to have a, all right, and then we'll say, okay, this is going to be, we do this one, right? So then after that, what's going to happen is that this secondary bronchi will give further rise. Okay, if you're talking about the right side of the heart, it will give rise to, we're going to give rise to like a 10 tertiary, or you can say segmental bronchi, and then your left side of your secondary bronchi will give about like 8 like tertiary bronchi. Okay, that's what it'll give you. So you can draw those 8 structures if you want to, but I'm not going to draw them, okay? But if you want to draw them, you can draw them. So just wanted to know though, like primary bronchi gives a secondary bronchi. Right side it gives you 3, and left side it gives you 2. And then the secondary bronchi will give tertiary bronchi or segmental bronchi. Right side will go and divide into like 10 different types of them, bronchi. And then the left side will go become your 8 side of the 8. It will give left side will give 8 different side of different tertiary bronchi. That's what it's going to happen. So then after that, what's going to happen? The tertiary bronchi, right? Or tertiary bronchioles, whatever it is. So tertiary bronchioles is going to become your respiratory bronchioles. From the respiratory bronchioles, okay, let's just quickly the respiratory bronchioles, okay, tertiary bronchioles, it will become your, then it will give rise to respiratory bronchioles. Okay, from the respiratory bronchioles, as the lung expands, it will become your respiratory or alveolar ducts, right? Alveolar ducts, and then it will become your alveolar sac, and then later it become your alveoli. And alveoli is a mature formations. Okay, that usually happens after the birth, right? And one of the most important things I do want to say this is that. Whenever it goes, because from the trachea they have the pseudo stratified cells, and it becomes like later become cuboidal, and then cuboidal, and then later it's just going to become a simple squamous epithelial cells when it becomes alveoli. Okay. Because that's very important for the good gas exchange. That's how this long developmental take place. But I do want to emphasize one thing though. As I said, so far all the endothelial linings of this formations of your lung, that is given by, okay, endoderms, but the muscles or connective tissues, okay, that is going to come from your mesoderm, spiking mesoderms. I do want to emphasize something. But one thing that I do also have to mention that is that Okay, that as this is going from here, like this picture's right here, as this going this primary bronchi, when this bronchi is growing, what happens is that it will participate in something. Okay, what is that? Is that it will get merged or punch into. Let me just erase this because I don't think you need this now. It will emerge into something called. It will emerge into the body cavity. Okay, this will, guys, will emerge into body cavity, and I have to draw body cavity in different color. Let me just write down different color, which is going to be red. Okay, so this punch into a body cavity, and what is that body cavity is called? I'll write this. I'm going to draw this one right here. Okay, so basically it's going to be like this. Okay, look, I just drew this, right? So the reason why I do this is because I'm gonna just erase this. Okay, guys, you probably already got this point now, right? So what happens is that this, guys, right here, you see that this bronchi, when they actually merge into the punch into this this layer of these cells, right? What is this? This the body cavity. We call this body cavity. This is we call this as. Right now, okay. It's called pleural, pleural, okay, pericardial, peritoneal canal. The name is crazy. It's called, this is what it's called. It's called pericardial canal. Okay, and this is just, and then what happens is that, okay, this is what a pleural pericardial peritoneal canal. The reason why they're called this pleural cavity because what happens is that as this lung keep expanding, okay, what happens is that this pericardial peritoneal, it will start emerging and folding together. And once it's folding together, what happens? It will give rise to a couple of structures. One is called, okay, we can say one is called PLE, pleural, okay, pleural pericardial fold. You can say that. Okay, and other one is called pleural peritoneal fold. That's what it happens. Okay, now, so this pleural pericardial canals, that kind of like, you know, it took a shape as this lung expanding, and then it will become a pleural pericardial fold and the pleural peritoneal fold. And okay, if I make this, guys, if I make this diagram right here, okay, this canal right here, right? No, okay, the lungs and all that kind of stuff. Okay, let me not even draw that, but just quickly know that this pleural pericardial folds, whenever this will take a shape, okay, it will start folding together like this. And then this pleural pericardial fold, when they start folding, they will separate a couple of structures. One is it will separate or give rise to, you can say, two cavities. One is called, it's going to be a pericardial cavities. And remember, cardial means what? Cardial means that it's going to be surrounded with what? With your heart. And then pleural cavity. Pleural cavities. And then we'll talk about the pleural peritoneal folds because this has to do with what? Talk about that. Okay? You probably already know, but I'm not going to, let's question mark. I don't want to tell you this, guys. We'll talk about that, all right? Now, this is what is going to happen now. The pleural cavities and pericardial cavities. And remember, that's the reason why the lungs kind of get merged, because this pericardial gets separated out and gives rise to this pericardial cavity, and then whatever space behind left, that is going to be pleural cavity, which is emerges by your lung cavity. Right? So that's the reason why. And the pleural cavities has what? So if I make this quickly draw this structures right here. Okay, so like right here, if I make this structure right here, okay, there's a lung right here, all right, and they're giving a rise to all this type of bronchi, and then all this, right, and then obviously it's going to give like all this different rise to the structures right here. All this stuff, I don't know, I'm just drawing, all right. All this kind of structures is giving rise to, and then all that kind of structure, right? So then obviously, if I make it, and if I surround it by this guys right here, I'll just make this as a structure right here. All right, sorry. Make it lungs right here, and then this is okay. We'll make it a little different structure right here, and we'll make this as a little bit, okay. We'll make this a little bit of like a coming out of sacs right here like that. Okay, just making the structures. Okay, it's not like anatomically correct, but I'm just doing it for functional. Okay, just like that. And then obviously these guys will have a structures like this, right? Surrounded by that. So now this is surrounding by this is called visceral. Okay, and this is going to be what? Parietal, right? This visceral parietal. And remember, this visceral and parietal, this viscera is actually occupying, or this is attached to the lung, and this is my lung, right? And the parietal, this is outer layer, okay? And this is actually, this attaches with my thoracic cavity. And then this space between is called, what is this? This is called my, this, you can say this is a pleural cavity, right? PLU, pleural cavity. Pleural cavity. And this is very important, this pleural cavity. This is very, very important. PLEU, pleural cavity, right? And they hold like a little bit of like about like 50 ml of fluids or so. All right. So that's how these lungs are formed. And these are very, very important because sometimes there could be problems with the pleuroperitoneal cavity, and if there's, sorry, not peritoneal, it's a pleuropericardial folds, then that means if the defects in that would not able to give a rise to pericardial or a pleural cavity. So that's something that we also have to talk about it. All right. Now this is something that I do want to mention about this. Now once we talked about this, then one of the things that we need to understand is that, okay, like, you know, we talk about alveoli, right? Now let's talk about how these alveoli get matured. I just want to quickly check that whether I'm missing anything or not. I don't think I am. Yeah, I don't think. Yeah, so I don't think I am. But one more thing that I do have to also mention, one thing is like this visceral, in order to like, okay, not even the way this pleuropericardial even formed is that the cell that came from is from two different types of places. Remember, if I quickly have to talk about this one, I was just mentioning, guys, you remember this cells that I draw? This is going to be my ectoderms right here, right? And then what it says, there's the amniotic layer that if you have to go back really old embryo and the notochord right here. Okay, and then we'll make this as a different layers of the cells right here. Right, this, right? And then this is going to be later. And then this is down here is going to be my endoderm right here. Right? And this is going to be yolk sac right here, okay? And then the structure that is coming down here, right here, this is going to be my what? Surrounding here. The splenic mesoderms, right? And then what is going to surround that thing right here with this, I'm going to draw this one is going to be what? Somatic pleuric, right? And this is going to be intraembryonic coelom right here, right? Intraembryonic cell. Now, see, in order to form, see, these internals are later come together with the lateral folding. What happens is that when the lateral folding happens, okay, they'll come and fold together, okay? They'll come and fold together. So that's how the cavities are formed, right? Now, this pleural, that's the reason why what gives rise to this the parietal pleura is the cells that are coming from your, like it's coming from your somatic pleura. All right. So this letter we can call them a somatic pleuric mesoderm. All right. And this one is called splenic mesoderms. I don't know how to spell this. Okay, this is what it is. So this is giving rise to your mesoderm, the visceral mesoderms of your lungs, and this one is giving rise to your the parietal pleuric mesoderms. Okay. Now once we have this, okay, we have to talk about the maturations of the lungs, and that's what we're going to discuss about right now. Okay. Now, what is the maturations of lungs? We'll talk about this right now. The different phases of the lungs, maturation phase, and we'll talk about it. Okay, let me just erase this part, and we'll talk about the maturation phase in a detail. Okay, let me just erase all of this. Okay, so we'll just talk about the maturations of the lungs now. The maturations of the lungs. Okay, how the lungs is maturation is very, very important concept. Really what happens, remember how I was like talking to you guys about like, okay, the first thing happens is like, okay, I'm going to look at the diagram actually. So the way the lungs happens is like the way the maturation happens. They actually categorize into 4 different phases. Okay, one is called pseudoglandular period. Okay, they call this as one of the phases called pseudoglandular period. That's what they called. And this is usually happens. Okay, and there's a time frame they have actually given, because this happens usually about like from like your 5th to like 16th week. Remember, like lung development is start taking 4th week, you know, that's what it happens, and then it goes to 15th to 16th. And then in the pseudoglandular phase, what is really happening here is that, okay, there's a formations of like all these things we're talking about. Okay, there's a formations of like, let's just diagrammatically look at how these guys are formed. They'll form up to like, okay, if I make this, you know, like what is this? Let me make this in my green color right here. It forms like, okay, there's a trachea right here, okay, and then it bifurcates into 2 parts, which is going to be right and main bronchi, right? And after that it goes and then goes and becomes here. It gives rise to like let's say another like 2 of them right here, and this gives rise to the 3 of them, okay, and then this will become like segmental, like tertiary, or become terminal bronchus up to terminal bronchioles. So like during this phase, it will go all the way down and forms up to like terminal bronchioles. Okay, but remember, in the terminal bronchioles, if the baby were born during the 5th to 16th week, do you think the baby will be able to survive? Probably not, right? Because it's probably not going to be compatible life. Because in that times, look, there's only formation up to terminal bronchioles. That means the baby would not able to participate in gas exchange. So that's what happens during this pseudoglandular phase. That's what happens, right? So no respiratory bronchioles or alveoli are formed during that time. Okay. Then after that, what happens is that then they hit this another period, which they call this is at a canicular period. Okay, these are called canicular period. I think that's what they call. What is it like? C-A-N-A-L-I-C-U-L-A-R. Okay. Canicular period, that's what they call, right? And usually this is about from like, okay, from the 5th to 16th week, right? So you take like from 16 to like 25th week. This is the time frame, okay? And during this phase, what happens is that, okay, from the terminal bronchus, okay, what is going to happen? You're going to form what? Respiratory bronchus, okay? So from the terminal bronchus, I'm going to write terminal bronchus right here. Then you'll make a respiratory form of bronchus. Guys, remember, the respiratory bronchus also have some kind of cells. They're called Clara cells, right? And they also, some of the cells appear there, Clara cells, and Clara cells also produce some form of like surfactant molecules. You just have to remember that too, all right? Respiratory bronchus. And then from the respiratory bronchus, what do they make? They will respiratory bronchus, they divide and make your alveolar ducts. Okay, that's what. So up to here, they're able to form up to your let's just write it down, the alveolar ducts. Okay, and maybe like, you know, like some of the blood vessels are like kind of like highly vascular too, by the way, at the time. But they'll up to form to the alveolar ducts in this period. Because really what happens is that when the respiratory bronchioles divides, it divides to like 3 to 6 alveolar ducts. That's what it happens, and it's kind of like highly vascular. Okay, and then if the baby was born in that time, then what happens is that the baby can like really survive in this time. Rarely survive, but they have to put in like ventilations if the baby was born in this time frame, because they are formed alveolar ducts. I do want to emphasize alveolar ducts here, right here, right? Now, other phase they're called there's a third phase, and these are all the maturation phase. Okay, we call them they call the terminal sac period. Okay, and what is terminal sac period is, this is one of the very, very important periods. The reason why it's a very important period is because this is usually from like a 25th week till birth sometimes, okay? Or you can say, yeah, till birth, right? And in this phase, what is happening here is that, okay, from the alveolar ducts, what happens? You're going to make what? You're going to form alveolar or terminal sacs that they make from the alveolar ducts. You're going to making this, all this alveolar sacs. Okay, that's what you're making that, right? Now, this is the one thing you're making. But they're also, or they also call this terminal sac, or they also call primitive alveoli, because it's not mature yet. That's what they call this primitive alveoli. And what happens is that if I make this primitive alveoli, what happens is that let's just make this as a primitive alveoli. What happens is that some of the cells, especially some of the cells right here, start appearing down here. And what are the cells called? They're called type 1 alveolar cells. You get to see there. Type 1 alveolar cells, or they're called type 1 pneumocytes, they also call. And around the 30 week, or around like 6 months or so, you got to also see the granular pneumocytes, or they also call this a type 2 alveolar cells, okay, or type 2 pneumocytes. They also get to see this, okay. And then what is the role of type 2 pneumocytes? One of the role is that they act as stem cells, okay. And then most important thing, they produce surfactants molecules, right? They produce surfactant molecules, and usually like from the 34th week, so there will be increased productions of, from the 34th week, there will be increased productions of your surfactants molecules, okay? And what surfactants does? Surfactants helps with what? Reduces surface tensions in alveoli, okay? It helps with better gas exchange, okay? It prevents from the airway to collapse. And it makes breathing much more easier, right? So if the surfactants are not produced, then what happens? You can have respiratory distress syndrome. That means the person would have difficulty breathing, okay? And sometimes, like, the baby who has let's say who haven't able to produce surfactants, sometimes the glucocorticoids are given there to increase the production of surfactants. Good glucocorticoid, the cortisol that is actually utilized to increase the production of surfactants. That's what they get to see. This is at times also there is like the highly vascular, the capillaries, they will come in contact. Capillaries in contact, meaning that they're forming now what? Blood-air barrier. All right, this is also happening down that time of phase, okay? Now, this is something very important, right? Now, if the babies were born like around, let's say like 25th to like, let's say from here to make this like 25th to like, let's say 28th week or so, we consider the premature babies, right? And for this one, like, it's very, and they have to put in the intensive care, right? Because the amount of surfactants are not produced by that time. Because usually the increased level of surfactant get produced around 34th week, and the surfactant is like it's a molecule. It's an amphipathic molecule. It has both hydrophilic and hydrophobic persons. It also acts as a opsonizations. What does that mean? Opsonization basically means is that, let's say if there's an alveolar macrophage, so the macrophage comes in right here, right? So what happens is there are those apoproteins like especially that what they do is like they'll go. Let's say this is my macrophage right here, right? And let's say this is my bacteria right here. Bacteria here. What happens is that, let's say this is my, like a bacteria right here, okay? So what happens is that this apoprotein go and stick with this this bacteria. So what happens is when the macrophage comes in, and when you try to gobble it up, what happens? It'll stick with the macrophage also. Okay, so that way the bacteria would not able to go away. So this helps with the phagocytic process. Okay, so opsonizations, that's what it does. And then obviously reduce surface tensions. Obviously that does, which increases the compliance. So it help with the gases exchange. Now this is really important because a lot of times like doctors try to also get the terminal sac period, so that way maybe we can somehow we can able to save the baby. Okay, and the last one is, we call this as a alveolar alveolar period, and usually it's like, this is like the, 8-month like to child, 8-month to like childhood, that's what they say. And this is the reason why, what is the most important thing is that the alveoli is, mature alveoli will develop, the alveoli gets like fully developed, okay? The mature alveoli gets completely developed, mature alveoli gets completely or fully developed into your endothelial epithelial contacts. That's what this happens.